Are you one of the 50% of Americans that has metabolic syndrome? And as a result, you're gaining weight even though you think you're doing the right things with your diet and exercise. It can increase your risk of stroke, heart disease, dementia, blood pressure. So let's get into what is metabolic syndrome. Well, metabolic syndrome really is characterized by insulin resistance. It's also known as Syndrome X. And basically, with this condition, you have elevated levels of insulin, and that's causing disruption in the body chemistry. It puts on weight, especially in the abdomen, causes your lipids to go up. It can lead to high blood pressure, fatigue, and things like this. But more specifically, in terms of how to diagnose it, you usually need 3 or more of the following items to be imbalanced. First, in men, your waistline, measured by around the waist and around the belly button, your waistline is 40 inches or more in circumference. For women, that'd be 35 inches or more. Blood pressure is usually elevated. Fasting glucose greater than 100 milligrams per deciliter. Your HDL is usually less than 40 milligrams per deciliter for men or under 50 for women. The triglyceride to HDL ratio is greater than 3. And so those are some of the classic things. But basically, if you have elevated glucose levels, you're putting on weight, you have lipid imbalances, there's a good chance that you have metabolic syndrome. And on lab tests, there's some other biomarkers you can use which can indicate that you may have metabolic syndrome. So for example, the small LDL dense particles could be imbalanced. You could have elevated uric acid levels in the body. You could have an elevation in inflammatory markers like C-reactive protein. The hormones of metabolism such as adiponectin and leptin are out of balance. And so these are other markers in the blood that can tell you that you may have metabolic syndrome. So what's the best way to address metabolic syndrome? Well, first, you need a diet that is controlling your carbohydrates. You need to get rid of the simple carbohydrates, high glycemic carbs, with diets such as a paleo diet, a modified Mediterranean diet, a modified keto diet can work as well. But basically, you need to get out the bad grains in your product, the refined wheat products, and you can see videos on my YouTube channel on why American bread and grain products are very problematic when it comes to inflammation and blood sugar levels. You need to eat quality protein sources, and you need to get in a high fiber diet. What also is very helpful is high intensity interval training. And that's the type of training, for example, where you'd like cycle very vigorously for up to 60 seconds and then cycle more moderately or normally for 1 to 2 minutes and then repeat this. And that over time, you build this up to about 15 minutes, 2 to 3 times a week. And studies show that can be very significant in improving metabolic syndrome. Now, obviously, that type of exercise should be done in combination with improving your diet. Next, I'm a big fan of the herb berberine. Berberine is shown in several studies to be comparable to drugs like metformin in lowering insulin and blood sugar levels. And so that does give you the advantage of helping to get that insulin resistance under control. Smaller amounts of chromium can be very good. Using fiber supplements, especially soluble fiber, can be very effective as well for metabolic syndrome. So when you change the carbohydrates in your diet, get in the quality protein sources, the good fats, the high fiber, you do more intense training like the high intensity interval training, and a few key supplements, you can make dramatic changes in your metabolic syndrome. And so many studies have been done where basically people are doing combination programs, the dietary changes, you're doing the high intensity interval training. Even without the supplements, you see significant impacts on people's weight, their body fat percentages, their lipid levels, their glucose levels within 2 to 3 months. And so these are dramatic changes that you can get if you address your metabolic syndrome. Well, I hope you found that this video was very helpful, and look for more videos on my YouTube channel. And until next time, I wish you well.